This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, so really quickly, I've got a medical minute on a recent study that was done which looked at the pressors of choice in post-ROSC patients. So someone who comes in, they had a cardiac arrest, and we get return of spontaneous circulation. Often there's a question of what pressor do you put them on. The go-to ones are going to be either norepinephrine or epinephrine, right? Norepi are a peripheral vasoconstrictor with a little bit of inotropy, while you'd think, maybe starting them on epinephrine, since they just had a cardiac arrest, getting a little bit more inotropy might be more helpful. So there have been studies which have looked at which one is actually better. And so there was a trial which was epinephrine versus norepinephrine in cardiac arrest patients with post-resuscitation shock. And do you guys have a guess which one did better? So interestingly, epinephrine was associated with an increase in all-cause mortality with an odds ratio of 2.6 and specifically cardiovascular mortality of 5.5. And then patients treated with epinephrine also had worse cerebral performance category score among those who survived and left the hospital. So far and away, norepinephrine is the pressor of choice to use in post-cardiac arrest. So but that's kind of cool. That's all.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.